Hey everybody, Rob Silverman here. Facebook Live, great Thursday. Got a really good topic today to share with everybody. Um, so many people had asked me some questions. Again, everything is in reference to COVID-19. So what we found out, we had talked about the pandemic inside the pandemic a few days ago. The pandemic was very specifically one idea of inflammation. Today, I really want to talk about the epidemic inside of the pandemic. There was a great article in the Mayo Clinic about this concept, about the epidemic inside the pandemic. And the epidemic is obesity. As we all know, Americans are too heavy. The numbers are really eye-catching in that we know that about 42% of Americans are obese, 75% of Americans are obese or overweight. It's about 10% of Americans are what we call morbidly obese, meaning that they can have a life-ending situation on any one day. So that idea of the epidemic and what that obesity can cause and the problems that it really segues to in reference to the pandemic, which is obviously COVID-19. Now, one thing real quick is obese patients have a worse outcome with COVID-19 infections. The numbers are without question in the corner of that. And that's unfortunate, which goes to that overall theme of the comorbidity. 60% of Americans have one comorbidity, but that idea that obesity really may be the starting point of the comorbidity. So clinicians need to be a little bit more aggressive when treating patients for obesity, especially those who are severely obese, because if they have that coupled with the COVID-19 infection, outcomes are really poor. Why does it pose such a problem? But we all know about the ACE2 or the angiotensin converting enzyme. That's right here. So what we found out, that expression in adipose tissue, fat tissue, is higher than in lung tissue. So ACE2 expression is higher in fat cells than in lung tissue. And everybody initially thought that COVID-19 was a lung disease. What that means that it's more prominent in fat than lung, it means that adipose tissue may be vulnerable to COVID-19 infection. So let that settle for a while. If it's present, we all have fat cells. I mean, we all should have two lungs, but we all have fat cells. And fat cells are depositories for toxins. And the idea that the ACE2 is more prominent than in the fat cell than in the lung should really have everybody stop and wonder, like, what's going on. Obesity also increases the duration of what we call the viral shedding. So we all talked about viral shedding before. The virus has to get out of your body. If you're not able to kill it or burn it or reinactivate it through a fever, it has to shed it. It sheds through your poop. And it increases the shedding time. So during that time while it sheds, you may be asymptomatic, but you can still spread it. So one of the things that we tell everybody is be really careful when you go into a public bathroom, even your home bathroom, things like that, because it still can be fecally orally transmitted. And this really speaks to increasing the time that can occur. Interesting. Aging and obesity share numerous causative mechanisms, largely linked to dysfunctional adipose tissue. So as you age, and if you're heavy, you have dysfunctional adipose tissue. You know, some adipose tissue, some fat cells, can be very metabolic, such as metabolic dysfunction with this adipose tissue, multi-organ damage, endocrine disruption, impaired immune function, and ultimately leading to chronic inflammation. One of the biggest problems that we're seeing is the idea of inflammation. Inflammation allowing the stickiness to the ACE2 receptor, the spike coming in, spiking, grabbing it harder, releasing a protease which is called furin. The obese population having more adipose tissue actually then having more ACE2 receptor levels. The more ACE2 receptors, the more organs, the more opportunity to get a stronger viral load, easier to get, COVID-19, worse outcome. Finally, the presence of ACE2 may enable the entry of the SARS-CoV-2 COVID-19 into the fat cells, which makes adipose tissue an important viral reservoir. So you can save more and more of the virus, get sicker and sicker, because your fat cells are great storage sets for COVID-19. So one of the biggest things that you want to do is, obviously, you want to lose the adipose tissue. You want to lose your fat cells. Remember, fat cells are depositories for toxins. Virus is a pathogen and it's very toxic. So I speak to a lot of my patients and say, well, what can I do? There is no vaccine. We've talked about that. There is no true medication yet. We don't have an answer. Lose the weight, lose the comorbidities, get healthy, increase your barriers, do your social distancing. But the number one thing that you can do is grasp your health, take care of your health, and make some necessary changes. So talk a little bit about obesity. Let's talk about obesity leading towards what we call immune dysfunction. So there's potential obesity implications and mechanisms in coronavirus. The biggest one is probably the cardiometabolic light, and we kind of touched upon that prior, in that we talked about it in the metabolic syndrome. So let's take a good look at that now once again and understand that that is a checklist. It's 3 out of 5 specific things. We're talking about hypertension, 130/85 and higher. My dad just called me. He's 89 years old, and he said that he just spoke to somebody, and he said, they just said now normal blood pressure is under 120. They just changed it, and I'm like, what? So I have to go check that. And he remembers when he grew up many, many, many years ago. I always tease him, did you vote for Lincoln? And he laughs. He says he remembers your blood pressure was 100 plus your age. So we've seen a lot that we've had to drop the blood pressure, but 130/85 is what we consider adverse. High LDL cholesterol over 100 poses an issue. LDL is the bad cholesterol. Means it should be low. L also means L for lousy. LDL is typically bad, but it's really the particle size. So I wish they would take the next step and speak to the particle size in LDL. That particle size is, if you have a small particle of cholesterol, it's easy to get under the artery. But LDL is the standard bearer for that metabolic syndrome. Low HDL, less than 40. HDL less than 40 for men. HDL should be happy. High, less than 50 for women. Women have higher HDL because estrogen raises HDL. And what I always like to look at, not so much the waist, but diabetes, blood sugar dysregulation. Over 100 of fasting glucose, it is too high. I don't want to go to 125. I don't want to go to 140. I want to see if you have over 100. And there's a couple of other markers, hemoglobin A1C, which really give you your average of blood sugar over 90 to 120 days. And some of the newer markers that I use is called a glycomark. And last but not least, triglycerides, blood fat. Triglycerides, if they're over 150, that pose an issue. So what happens is you consume sugar, or too much sugar. Too many Americans consume sugar, you get heavy. Your increase, your triglycerides leads you to high triglycerides. Your high triglycerides then go to VLDL and then go to the LDL. So sugar can lead to a lot of these issues in cardiometabolic issues. In addition, inflammation can be increased if you're obese. Some things you look at are interleukin 6. Interleukin 6 is the bad guy in the cytokine storm. And then you have TNF alpha, which is another inflammatory pathway. And believe it or not, an increase in leptin, all of these lead to inflammation. So just let me say, I know I see a lot of people starting to pop in now, came in a little late. Here's my suggestion. Like it, share it. Please, you guys did a great job sharing yesterday. I know everybody can't watch it live because everybody's working. There's something, you're eating lunch. You're busy at this time. I get it. So please share it. Like, click, share. Please follow us on LinkedIn, which is the same Dr. Robert Silverman. We're putting things out every day. Get back to this immune dysfunction with obesity. We also have some issues with hypercoagulability, which talks to the idea of too much coagulation, issues with your blood. We're also having pulmonary function issues that we're seeing because of obesity, heart issues, kidney issues, and actually inflammation in what we call the endothelial cells. So blood pressure and actual clotting of the endothelial cells. So the real takeaway here for today's very concise Facebook Live is the epidemic inside the pandemic. So the epidemic is everybody's too heavy. America is becoming corpulent. Once again, 42% of Americans are obese, 75% of Americans are obese or overweight, about 9% are morbidly obese, and we define that. Americans consume too much sugar. All this inflammatory status or increased inflammatory status makes everybody more susceptible to COVID-19 and more susceptible to a severe outcome within COVID-19. So one of the biggest things you guys can all do is get into the best physical shape that you can, because that's going to be our biggest option. That's going to be our, if you will, our vest. That's going to be our brace. That's going to be what protects us from this virus coming back over and over and over again. By the way, bad foods, failing health actually damages our immune system. And our immune system is our search and destroy, recognize, and memorize system to help prevent and decrease inflammatory factors when we're attacked by pathogens. So once again, if anybody has any questions, please feel free to reach out to me. Like, share, comment. It's been my pleasure. We'll see you tomorrow. Dr. Rob, always yours in health.